So my idea was about recycling elbow crutches that we give out to patients within the Trust. It was an idea that came up about 1 or 2 years ago. The Trust purchases and supplies through A&E, through day surgery, through orthopaedics, all the elbow crutches that we give out to our patients. But there was no way of actually having these elbow crutches back. They were just constantly buying new elbow crutches. So we just came up with the idea of being able to recycle those, but in a safe way so that it wouldn't affect patient safety and obviously then would allow the Trust to stop utilising and buying all these extra pairs of crutches. It also means that the estate department aren't obviously disposing of all these elbow crutches as well. So hopefully it was a simple idea that the team are really now affecting the Trust. The patients know that they can bring them back, and overall, okay.
So in radiology, we've introduced a new system for imaging inpatients, whereby when the inpatients come down to X-ray, we transfer them either onto a bed or, depending on the imaging, onto a radiolucent X-ray trolley, where instead of previously where we would use an X-ray detector physically under the patient, we can now actually put the patient on the bed, nice and comfortable, on a foam mattress, and the detector goes underneath the patient, so it's no longer in direct contact with them, making it more comfortable, less chance of causing any further damage, better for bed sores, but mainly improves the patient care while they're in the department.
Hi, we're the neonatal outreach team, and this is our neonatal outreach support group. So this support group was set up at the beginning of the year for mums and babies from special care.
So we set up this baby group just so that parents could come, because we don't recommend that babies that have been in special care don't go to normal baby groups just because they're a bit more susceptible to infection.
So today we've done a Halloween theme for group. Our babies are coming very shortly in their Halloween outfits, hopefully. Obviously we've dressed up for the occasion as well. And as you can see, we've trimmed up for the babies too. There's quite a lot of sensory things going on ready for today.
Hello, my name's Gemma and I was part of the Human Hospital project that basically involved having a giant 7-foot teepee in the main foyer of the hospital, and it was there to offer people support if they were having a tough time, but it's also a space that weren't trying to fix you or sell you anything. It was just a space you could be and meet people and meet strangers and have conversations. 30,000 people visited the teepee and we had over 700 postcards telling us what a massive benefit it was to patients, staff and carers.
Ours is the first contact physiotherapy service here in Rotherham. We are the advanced clinical physiotherapists, seeing people with musculoskeletal needs. The key innovation from our service is that we deliver this across a hub model. So we are based in 9 GP practices, serving 29 GP practices over the whole of Rotherham. The other key innovation was our booking system. We work on a remote booking system similar to GP out of hours systems, and we amended that booking system during the course of the last 12 months to allow patients free access to any appointments that are available with any of the 6 clinicians.
You're on the run. If you like.
In September 2018, I introduced the idea Bob, bum off bed, for our fractured neck femur patients. So this initiative was to aim to get patients out of bed first day, whether that was to stand or to transfer to a chair to start their rehabilitation journey. The numbers have significantly increased within the last year, which is evidenced on the hip fracture database, and our length of stay is below the national average.
Our project looks at providing emotional support to staff following traumatic events at work. We've managed to secure funding from the Yorkshire and Humber Academic Health Sciences Network, and we've had the involvement of eminent professors in psychology and patient safety to support this project. There's a pilot that will go live in critical care in November, and we hope that all our staff will feel supported by this. We think it's a good idea because from a legal point of view, we have a duty of care to our staff. From an economic point of view, we want to keep our staff happy, healthy and in work, and we're doing it because it's the right thing to do.
In 2017, I won the Proud Innovation Award for an idea that I had for an app to deliver voice therapy to patients so they could access exercises between therapy appointments and we could support their therapy between appointments. At the same time, my colleague Rebecca Davies was looking into telehealth and video appointments for our service. And we started using a program called Microsoft Teams. We discovered that actually Microsoft Teams could deliver video appointments, but it could also deliver all of the things that a voice therapy app could do. So we combined forces and have started delivering video appointments through Microsoft Teams to patients, but so that they can also access all their exercises between appointments. They can contact therapists, they can get all their exercises uploaded onto their phone and carry their therapist around in their pocket.